Alright, we are going to do a lecture on joints now, articulation. So, this is kind of funny. I don't always roll a joint, but when I do, it's my ankle. You know, try to make it a little funny. Alright, so what are joints? Joints are articulations, functional junctions between bones, enable a wide variety of body movements, bind parts of the body together, make bone growth possible, and permit shape changes during childbirth. Can be classified according to the degree of movement they allow. So immovable means synarthrotic. Syn means unable to, arthrotic is joint. Slightly movable, amphiarthrotic, and freely movable, diarthrotic. Can be classified according to the type of tissue that binds them. Is it fibrous, composed of dense connective tissue? Is it cartilaginous, composed of cartilage? Or synovial, have a complex structure? And most of the things that you see in the clinic are going to have issues with synovial joints. Fibrous joints found between bones that lie in close contact. They're held close together by a layer of dense connective tissue. Most are immovable, such as the sutures in your skull. A few are slightly movable, such as the joint between the distal tibia and the fibula. So those are fibrous joints. So if you look at that, here's an example of fibrous joints here. Immovable. Can't say, hey, move those skull bones. Doesn't work. All right, cartilaginous joints connected by either hyaline or fibrocartilage. The intervertebral discs between the vertebrae help absorb shock and are slightly movable. Other examples include the pubic symphysis and the first rib, which is here with the sternum. Synovial joints, again, the more degrees of freedom you have, the more problems that can occur. They have a complex structure than fibrous or cartilaginous joints. Most of the joints in the skeleton are synovial joints. Articular ends of the bones in the synovial joint are covered with hyaline articular cartilage. I mentioned this prior to that. Once the articular cartilage gets worn down, it can't repair itself. So that's when patients say, I'm bone on bone. Joint capsule consists of an outer layer of dense connective tissue and an inner layer called the synovial membrane. Synovial membrane secretes synovial fluid, which will help lubricate the joint. So here's the general structure of synovial joints. So you have spongy bone, compact bone on the outside. Here's the synovial membrane. There's articular cartilage that helps absorb the shock. There's the joint cavity filled with synovial fluid, and the joint capsule, which is the fibrous capsule here. Now, if you like to crack your knuckles there, probably people have told you that, hey, you're going to get osteoarthritis if you keep doing that. Well, you're actually just releasing the gas that tends to build up here. So joint capsule houses the lubricant for the joint. The capsule is a closed structure and does not allow the lubricant out. The lubricant in the capsule is thick and viscous material. As it moves inside the capsule, it can build up little bubbles of nitrogen, oxygen, and carbon dioxide gases. So when you quickly pull, stretch, or flex the joint capsule stretches, and those bubbles can pop, which is what that cracking sound is. I can't crack it anymore because I just cracked it in like 5 seconds ago. But if I wait maybe 15-20 minutes, the little bubbles of nitrogen, oxygen, carbon dioxide will build up again. So maybe I'll wait till the end of the lecture and say, hey, it's built up again. So, basically when you're cracking, you hear those large audible pops, you're just releasing that gas. So, if you like to go to the chiropractor and get that pop, I don't want to make a blanket statement, but all you're doing is releasing that gas. And sometimes it does help align the joint. So I don't want everyone to think that it doesn't help. But a lot of times you are just releasing that gas and it's just making that audible pop. We think that that's going to align everything, but you need to stretch, do strengthening in conjunction with that so that you can get the best results. There's never a quick fix. All right. Some synovial joints contain shock-absorbing pads of fibrocartilage called the menisci. You've heard of people with meniscal tears or meniscus. Some have fluid-filled sacs called bursa that aid in movement of tendons. So people can get tendinitis or bursitis. Bursa is water-filled, and tendons are contractile. So if a patient comes in and says, hey, I have pain with movement, that's usually tendinitis. But if they say, oh, it just hurts even when I'm here, that could be bursitis. Most people have a combination of the two, but just to tell you the difference between bursitis and tendinitis. So here's the meniscus and bursa of the knee joint. The knee is very complex. Here's the femur, here's the tibia, here's the meniscus that are in between. Here's the patella, which is your kneecap. You have a prepatellar bursa, you have an infrapatellar bursa, you have a suprapatellar bursa. So if this gets inflamed, you're going to cause pain underneath the knee joint, underneath the kneecap. And bursas, once they get flared up, they take a while to calm down. Sometimes you do have to drain them if it gets too bad. But the reason you have this bursa is to protection, right? And to absorb the shock, distribute the forces. So they serve a good purpose, but with repetition, excessive running, jumping, track, soccer, you name it, everything can get inflamed. That's your body's way of saying, hey, take it easy, take some time off. But as athletes, we have a difficult time. I say we, but, back in the days when I used to run and play, not anymore, it's difficult to sit down. Okay, so there's different, now we get to the meat of the lecture, which is classification of the synovial joints. One common one is called the ball and socket. Just like it sounds, here's a ball, here's a socket, bam. So my shoulder is a ball and socket. My hip is a ball and socket. Consists of a bone with a globular or egg-shaped head articulating with the cup-shaped activity of another bone. Allows the widest range of motion, including movement in all planes. Examples include the shoulder and the hip. The condylar joint consists of an ovoid condyloid fitting an elliptical cavity, permits back and forth and side-to-side movements within two planes, but not rotation. Examples include metacarpals and the phalanges. Okay, so these are condylar ellipsoidal. Okay. The plane gliding joints, articulating surfaces, are nearly flat or slightly curved. Allows for a sliding or twisting movement. These are my wrist and the ankle, vertebrae, and the SI joint. Hinge joints is a convex surface. A bone fits into a concave, convex. Okay, surface allows for one plane of movement, like a hinge on a door. So the elbow joints and some of the phalanges are here. Those are hinge joints. Pivot, trochoid joint, a cylindrical surface rotates within the ring of the bone and ligament. Allows only rotation around the central axis. Joint between the dens of the axis and the atlas. You remember the atlas is C1 and C2, so the pivot, it allows this rotation, this pivot to occur here. Okay, so here's the dens, here's C1, and I'm rotating slightly. So that's the pivot. A saddle joint is found between bones that have both concave and convex areas. Bones are complementary. Okay, and so you can go in two planes of motion, and the joint between the trapezium and the carpal bone and the metacarpal of the thumb. So the thumb allows for those degrees of movement. So the way that these bones come together can dictate how much movement, how easy is it to move, how difficult is it to move, what's the purpose. So that's the real purpose of joints though. So the design of the joint can dictate how much degrees of freedom we have. So here are some examples if you're more visual, as some of you are. Here's the ball and socket, here's a condylar, here's a plane joint, a hinge joint, a pivot joint, and a saddle joint. Now, one thing that I do like to point out, because at the end of the day, it's all about what do you see clinically, and there's a very important concept called mobility versus stability. And each joint is designed for a purpose, right? So if you look at the ankle joint, it actually should have a lot of mobility, right? I mean, you need the flexibility in the ankle. Your knee should be stable. Your hips should be definitely mobile. Your back should be stable. That's why we do a lot of core exercises. Your thoracic spine should be mobile, and your neck should be relatively stable. The reason I point this out is, well, the body does a good job of compensating if one is not doing its job. Let me give you a perfect example. If my hips are real tight, right? Well, I got to move. So if I don't have mobility at the hip, where am I going to get it? Back and knee. And what do we have see in the clinic? A lot of back pain, a lot of knee pain. So maybe the source of your back and knee pain might be your hip. That's why stretching out your hip might be important. Let's say you have knee pain and your hip's pretty good, but your ankle's real tight. Well, maybe stretching out the ankle might be the solution here, right? Sometimes we just go to where the pain is, but we don't look above or below the joint. That's very important for you to do. Again, let's say you have neck pain. Now you just keep rubbing the upper trap and you say, oh, I have all these knots. Well, did you ever look at your thoracic spine and see how mobile it is? If you have real tight thoracic spine, maybe your neck muscle and neck is moving too much and your neck's getting tight to say, hey, stop moving too much. You see what I'm trying to do is trying to give you, the more you learn about anatomy, then maybe you can treat it better by taking a step back and looking at the whole picture instead of just focusing on where the pain is. This is just a summary of everything I've told you. Fibrous versus cartilaginous, synovial, ball and socket, gives you examples, describes it, condylar. So I don't have to read this again, but this is just kind of all in one. Plane, hinge, pivot, saddle, and again, it gives you examples on the side here, and then right there. Now, the other thing that when these joints come together, where they allow movement, so you need to understand what each movement is. When a muscle contracts, its fibers pull the movable end, the insertion to the origin. We haven't discussed muscles yet, but we'll talk about origin insertion here. But usually when my biceps contracts, I'm pulling the insertion towards the origin. So this is called elbow flexion. Flexion means bending parts of a joint so the angle between them decreases. When I want to straighten it, which is called extension, so the angle between them increases. So here's wrist flexion, and here's wrist extension. If you look at my neck, neck flexion, neck extension. Okay? Lateral flexion is to the side. And abduction is going away from the body. Think about alien abduction, right? They take you away. And then adduction is bringing it into the body. Okay, moving apart toward the midline. So here's abduction, here's adduction, here's lateral flexion, here's knee flexion, you're bending the knee, and the knee extension, you're straightening the knee. Dorsiflexion happens at the ankle, so if you see my ankle, I'm bringing the ankle up. Plantar flexion is down, where I'm pointing my toes down. Rotation is, here's cervical rotation. Okay. Circumduction is I'm circumducting, going around, circular. Pronation and supination. So if you were to look at my hands, if my palms are up, I'm supinating, palms up. I usually say, hey, sup, sup. And then pronation is down, pointing down. So here's dorsiflexion, there's plantar flexion, there's circumduction. Medial rotation is going towards the middle. Lateral rotation is going out. This is also known as external rotation or internal rotation. And it makes sense. And again, supination is palms up and pronation is palms down. Inversion, eversion. Remember when you sprain your ankle, you usually do an inversion sprain. It's going in. Eversion is out. Protraction is like this, or I'm protracting my shoulders. Retraction is I'm squeezing my shoulder blades back, or I'm bringing my chin in. Elevation is up, and depression is down. So here's inversion of the ankle, eversion of the ankle, protraction of the jaw, retraction, elevation, depression. Now, when these joints start to wear out, you might need total knee replacement. So they replace it with different components, but it's usually chromium, cobalt, titanium. Okay, so first total hip replacement was performed in 1963. It's a very common procedure for the elderly. If you live long enough, the wear and tear of the joints are going to occur, and then you become a bionic person. I won't quiz you on, what this is. I just wanted to show you how that is. And then what's going to keep you in business is basically all the injuries to the joints. Football it is. Look at, here's some knee hyperextension here. Here's some extension of the spine, flexion of the knee here. That doesn't look like an anatomical position right there. That's not. And this one definitely not an anatomical position. We can see it. I don't even see, well, his foot's pointing the other way. Yeah. So joints. There you go. Hopefully that helped.